Ladies and gentlemen, my name is Raluca Ioana Nedelea, and on behalf of our team, Dr. Andreea Marincuș, Dr. Adrian Toma, Dr. Cătălina Cârdeiu, and Professor Flavi Tăvăran, I will present you today a large Dentigerous cyst in a 7-month-old cat. We come from the city of Cluj-Napoca, Romania, a city full of history and tradition in medicine and veterinary medicine. For example, our faculty of veterinary medicine has more than 100 years of academic teaching. Dentigerous cysts are cysts that derive from the epithelial cell rest of Malassez. Usually, they appear associated with the crown of a permanent tooth, enclosing the crown and being attached to the cementoenamel junction. Fluid deposition into the space between the crown of the impacted tooth and this tissue is the physiopathological mechanism of Dentigerous cyst appearance. Development of the cyst may encompass the entire tooth and adjacent teeth and jawbone. Dentigerous cysts are more frequently found and reported in dogs. For example, the latest study published in 2019 by Bailey et al. 44.4% of the unerupted teeth in dogs and 1 of 5 unerupted teeth in cats are associated with Dentigerous cyst. This epidemiologic study revealed the much lower incidence of the impacted teeth in cats, 69 dogs versus 4 cats, on a retrospective study between 2001 and 2018. A case of a maxillary impacted canine causing a Dentigerous cyst in a cat was reported in 2003. Because of the reduced volume of the facial bones, brachycephalic breeds are more prone to develop Dentigerous cyst. Our case is about a Dentigerous cyst in a cat caused by an impacted upper right maxillary incision 103. A 7-month-old British Shorthair cat was presented for facial asymmetry and the presence of an oral mass in the right frontal region of the maxilla. The swelling could be easily seen by lifting the upper right lip, and it left the place only for the lower canine to occlude. In addition, a trace left by the lower canine was easily seen on the swelling. The dimension of the swellings were in height 2 cm, in length 3 cm, and in width 0.81 cm. The mass was hard on palpation, and the mucosa overlying the swelling had a normal appearance. 103 was missing from the dental arch, and 102-101 were displaced to the left. All these can be easily seen on the intraoral photographies that are shown on this slide. Several radiographies were taken. They revealed a circular, unilocular, radiolucent lesion with a well-defined cortex enclosing the crown of the upper right maxillary incisor 103. In addition, the adjacent teeth in contact with the cyst 102 and 101 had their roots displaced. The Dentigerous cyst included the anterior palate. The dimension of the lesion measured on the dental x-rays were 3 multiplied by 2 multiplied by 2 cm, meaning a gross Dentigerous cyst. Management of the Dentigerous cyst was made by extracting the unerupted tooth and the ones displaced by the cyst 102 and 101, all together with enucleation of the entire cyst. Extraction of the unerupted tooth was performed with an open technique, drainage of the cyst fluid, and removal of the entire cystic lining. A bone graft was placed because of the significant defect then resulting with a high risk of pathological fracture and postoperative complication. The bone graft used was a fully synthetic bone substitute material characterized by controlled resorption properties and outstanding handling characteristics. The bone graft comprises 60% low resorping hydroxyapatite and 40% fast resorping beta-tricalcium phosphate. The unique synthesis-based production process ensures an entirely homogeneous distribution of both material phases. In addition, the peculiar composition of the bone graft used, that was max restored from botish biomaterials, promotes the rapid formation of the new vital bone while ensuring a long-term mechanical and volume stability. In order to increase the acceptance of the bone graft, we have combined it with advanced platelet-rich fibrin. Finally, the excised tissue was then sent to our pathologist, confirming the diagnosis of a dentigerous cyst. Discussion. Every unerupted tooth in dogs and cats after the age of 6 months should be radiologically investigated. Not every unerupted tooth will develop a dentigerous cyst. In the case presented, the cyst dimensions correlated with the patient's age were surprising. The patient was a very young cat with a significant bone defect. When dealing with gross dentigerous cysts, treatment possibilities are two: a two-step approach by marsupialization, or enucleating the cyst entirely and bone grafting with epithelial in the same intervention. Our experience with the allogenic bone graft use is a successful one. That is why we have chosen this specific product. Conclusions. Even though the patient was very young, only 7 months old, it presented a significant bone defect due to an unerupted tooth. Therefore, every unerupted tooth should be radiologically investigated, as there is no correlation between the age and the dimension of the bone loss. Even though 1 of 5 unerupted tooth in cats develop dentigerous cyst, the practitioner has to consider every unerupted tooth as a potential developer of a dentigerous cyst. It is recommended to be counted all teeth when patients are present for vaccination, neutering, or whenever a dog and a cat has an edentulous area. Bone graft with allogenic materials and epithelial is providing their efficiency in extensive bone loss. On behalf of my team, muchas gracias, España. I have searched among my memories, and as you can see, I have found a picture of me in Barcelona in a cold November. Let's hope that in the near future we may see each other face to face. Until then, muchas gracias otra vez y hasta pronto. Thank you.